Okay, now that she's flipped over and she's laying supine on her back, we're now going to, our goal is to access these neck flexors because these muscles are overly tonic. You can see how these scalenes actually run and they attach to that cervical spine. The more compression that we have on the cervical spine, because our brainstem runs down through and our spinal cord runs through, the more restriction that we have on there, the more restriction we have on our brainstem, which can inhibit coordination, which can give us brain fog, which inhibits communication from the brain to the head to our body, you know, like our communication system. So a lot of people that have forward head have migraines, have brain fog or lethargy, and just like working and having that focus in at work is not very easy. So the more we can work with getting the head back, getting the muscles that are tonic, that are overly contracted and weak, then we can get a good posture, get that natural curvature back, and everything can flow properly and the body can heal. But before we do that, I need to check her shoulders. Okay, are the shoulders even? So this right one is a bit higher, so I'm gonna do a little bit of work in the right shoulder to get it down. But if she had a shoulder that was like way up forward and tight, all the muscles on this side of the neck are going to be very, very tonic, and this left side is going to be much looser. So it's going to be more difficult for me to work these tissues if they're running, you know, if this is forward, because of how those scalenes are attached to those first three ribs, and the SEM is attached to the sternum and then to the clavicle. The more forward the ribs and the clavicle are, the more elongated those muscles are going to be. So when I'm working them, I'm not going to be able to get them back shortened to their natural length. So I'm going to first have to work with these shoulders to then get the neck back. And you can do a little experiment yourself. If you sit and you lean forward, roll your shoulders forward, and try and bring your head back, it's almost impossible to get your head up. You're gonna feel all this pull, but then if you bring the shoulders back, externally rotate your arms, and then you can bring that head back easily and bring that chin back, and you can sit up straight and just feel this pull of your head versus this pull down and forward. All right. And typically, if the shoulder is rotated forward or anteriorly, then the deltoid is going to have this, the humerus is going to have this kind of medial rotation or internal rotation. So, and the way that you can tell is that if her thumb is more towards the lateral side, like more towards me, her shoulder is more in external rotation. If her thumb naturally goes in, there's more internal rotation. So when you're standing and you're standing down, if one of your thumbs or two of your thumbs kind of naturally hang in, then you know that you have more tightness and more internal rotation and the shoulders are pulling in. So I want to do the opposite, and I want to encourage the external rotation so I can get that hand to go back more out and the chest can actually push out more. Okay. And I'll make future videos on more detailed work of what I'm doing, but right now I'm just trying to do some just quick work to just kind of get a bit more mobility so I can access the neck. But you see, there's like a lot more prep work to do and layers to go through to really access the muscles that you want to work, because our body is so complex and it's layered. It's not just one piece. Like, you can't just work one section of the body without impacting the other sections of the body. Is that tender in there?
A little bit.
So now you can see that they're a bit more even. Okay, there's still more work to do on this right shoulder, but for time purposes, we're going to do it as much as we can to kind of work that and kind of activate that area. And then we want to focus the majority on her neck because she's having migraines today. So we want to do our best to get her down from 9 of pain down as far as we can. So the more that we focus on the area of concern, it's going to give her more relief than trying to fit in a full body from head to toe in 1 hour. All right. So now I'm coming under, and I'm up on the traps, and I'm using gravity and her body weight to actually push down on my fingers. The body responds much better when you have gravity pushing down than us pushing down on top of the person's body, because the body is, the nervous system is used to laying on top of things and having objects underneath them. But you know, it's not always natural to have something poking on you, because our body doesn't want to be impaled by a boar's tusk. So if it doesn't understand what is pressing on the body, then it's going to be, at first it's going to be reactive. But then the more massage that people get, the easier it is for their body to respond and relax to your touch. So now I'm just kind of like palpating each vertebra to kind of see, are the muscles in line? Is one side pulling the head to the other? Kind of just palpating the structure of the cervical vertebra to see where their position is in space. Now I'm gonna make like a football goal post, and I'm gonna come under, press up on the spine, and drag towards the occiput to get this traction. So if you've ever been to the chiropractor and they have a table, a traction table, there's wheels that will come up out of the table, press up on your spine, and roll all the way to your head, from your tailbone to your head. And that will actually give you some traction and open up the spaces of the discs to have them imbibe more fluid and hydrate. So we're trying to do the same thing here, because there is no direct there's no direct blood flow to the disc itself. It gets its nourishment from imbibing that fluid, synovial fluid. So in order to do that, they have to move, they have to open and close. But once they get so tight, that's when the cookie cream, if you will, of the Oreo cookie dries out, and then those discs start to compress down. So we want to encourage that movement and blood flow and circulation to those discs. So now I'm just bringing up and pulling. Reaching with the next hand down, bringing up and pulling. Kind of like if you've ever been on a boat and pulled in a tow rope from the water, you're grabbing one and pulling, grabbing the other hand and pulling. And then I'm going to do the same thing on the bottom with the goalpost, but then I'm just going to rest her head on my hand. And I'm around like C4, and I'm just letting her head naturally drop into my fingers on each side of the spine. And then her head's gonna relax and relax and relax. If you do this and they're so tight that their nervous system jumps and kind of wants to push you off and it's too much, then you can just hold the back of the head and just lift up a little bit and give pressure, and then slowly try and drop the head down as their body responds accordingly. But ideally, you want to have their head completely neutral and laying on your fingers. So I'm going to hold that minute and a half. Then I'm going to slide back up with the traction again, and then just move my fingers up to C3, and then lay the head down and just allow gravity to fall. This technique is going to take some grip strength, so at first it might be quite strenuous to you. If that is the case, then you can put all your fingers together, and then you're going to use both fingers and just hold like that. So coming up and holding. This way you get more support of the fingers together than just those two fingers. So now I'm right in the back of the occiput, and at the capitis muscles, just really on that insertion point into the back of the cranium. And I'm dropping the head down on there. And then after 30 seconds or so, I want to kind of grab the skull and just give a little bit of a pull. And you see how her chin went down a little bit? I'm encouraging this lift of the head and even more traction of the spine and extension of those muscles. And I just want to encourage the length. Now, I'm going to work the lateral side. Now, the rest of SCM, some back here, area. Now we're going to pull here, we're going to get into scaling muscles. Okay? So, you can just turn your head this way. Now you can access or if it's elongated and then it comes back. If you pull it longer, it can activate the stretch reflex and the person can flinch and just tighten up. So what I like to do is actually compress the tissue or contract the tissue, shorten the tissue, and then the muscle body becomes larger. And then I can actually